Hello, friends. My name is Dr. Rajiv Chhabra. I am Chief of Pediatrics at Artemis Hospital, Gurgaon. Today, the point of discussion is about iron deficiency. And what my view is, while I was doing MD, we used to see quite often iron deficiency in kids because of they were coming from a downtrodden area where diet was not adequate. But nowadays, when there is abundance of everything, especially in the elite population which I'm treating these days, again we are seeing the same trend, and the reason being these days again faulty exposure to few things, as well as much more importance given being given to milk. I can tell you, in the milk is being so much given in quantity that it contains abundance of calcium, which tends to chelate iron out of the body. As a consequence, the incidence of iron deficiency has drastically increased. Well, if anemia is there, then iron is required for formation of hemoglobin and an other molecule called as myoglobin, which is present in muscles. Hemoglobin tends to carry oxygen to various body parts. So you can imagine a scenario where there is insufficient hemoglobin, resulting into lack of oxygen to the peripheral tissues. And because kids, each and every organ is developing, and there is a limited phase where development can happen, therefore all these organs are remain underdeveloped or are much more prone for infections, which we can discuss later on. With that brief introduction about iron deficiency, I would ask Dr. Sangeeta to introduce herself, please.
Thank you, Dr. Rajiv. Nice hearing from you. Myself, Dr. Sangeeta, and I'm working on Aniema Mukt Bharat program. I have worked a lot in gynae department. Basically, I've done my DNB training in gynae. So, seen a lot of pregnant patients coming to us late in pregnancy and very much deficient in iron. Their hemoglobin levels are at 34 and 30 to 36 weeks of pregnancy. Their HB levels as low as 5 to 6, because initially half of the people are not aware about taking iron at the right time. They are not aware about the proper diet, and they are not even aware about the enhancers and inhibitors which can increase iron absorption in the diet. So basically, India is lacking behind. There's quite a lot of prevalence of anemia in India, and according to WHO, if there's more than 40% prevalence of anemia in any particular place, so it becomes a major public health problem. We'll discuss the rest of the things later on, and I'm passing to Kanika.
Hi, good evening, everyone. Hi, good evening, everyone. I'm Kanika, and I'm a nutritionist, an integrative nutritionist. And I have seen a lot of people who come to me and they say that I have tingling sensations in the fingers and toes. What should I do? And when we get their tests done, we come to know that they're iron deficient. So basically, their hemoglobin levels are quite low, because of which they have these problems. That again depends on what diet they take. So the diet plays a very important role in the absorption of iron. It should be rich in vitamin C as well, because vitamin C helps in the absorption of iron in the food. So vitamin C rich, vitamin iron rich foods are very important for everyone, so that they don't go into anemic states. Uh, that's all I can say right now. We can discuss some things later.
Prophylactic dose, the six beneficiaries, the program goes as WIFs, weekly iron folic acid supplementation. So in that, why ASHA workers and why school health, we provide for young for 6 months to 59 months. That means that is 5 years. We provide syrup iron in the field area by ASHA worker to all the kids once week by bi-weekly. That is to with 1 ml as the dose using auto dispenser. So for 6 months, 6 years to 9 years, we have pink tablet, and a little dosages, little different dosages being used that I don't want to mention right now. That is in that this program goes in school also for in school children, and out of school children. They are the program is conducted by ICDS project through Anganwadi workers and ASHA workers. And again, we have adolescent group where the tablet blue is provided. That is IFA blue. in school children and out of school children. So for in school children, 6 years to 9 years and 10 years to 19 years, the teachers they help in conducting the program, and they are supplied with the medicines. And then comes the women of reproductive age. Once weekly, the tablet is provided by ASHA workers. In pregnancy, compulsory 180 tablets to be taken from 4th month to 9 months of the pregnancy. And in lactation also, 180 days tablet is to be taken, iron folic acid. Even calcium is being taken. So this is the basic approach of WIPS. Maximum is the government point is to cover the maximum beneficiary population, and our target is to reduce anemia by 3% per annum in all age groups. So this is about WIFs, and along with that, deworming is also being done. Deworming for small kids less than 5 years, and from 6 years to 19 years, it has been done in school biannually, and in pregnancy and lactation, it has been done once during pregnancy and once during lactation. I mean, in a gap of 6 months. And deworming should be a part of the program. It should cover everybody irrespective of the beneficiary age group provided by the government. क्योंकि ना because actually we have worms in our body, and that decreases iron absorption, because intestinal inflammation occurs because of the worms, and so iron isn't absorbed properly, and so we have to do deworming frequently. There are a lot of parasitic infestations. Secondly, in for pregnancy also, in all basically all government hospitals, maternity homes, government we have started T4 anemia rooms. So in that room, whenever the patient comes for antenatal checkup, she is being directed to that room, anemia rooms, and corners in dispensary, and anemia rooms in hospitals and maternity homes. And the patient goes there, everything antenatal checkup, weight, BP, every height, everything is taken along with the blood test. So point of care basically is that at one place everything is being done. या तो computerized automatic machines are there for taking the blood test, or by digital hemoglobinometer. And there the same time, at few places, by digital hemoglobinometer the report is being given to the same patient. Everything is recorded in the register. If patient falls in mild, moderate, and severe category, patient is asked to take the tablets accordingly. And patient is being tracked also. T4 basically the approach is test, treat, talk, and track. So test is being done, then the treatment is being done, then the talking is being done by dietitian and the nurses and the doctors about the diet enhancers, inhibitors, the diet covering iron rich diets from non-veg to veg and to millets, and even the recipes. And tracking is till their hemoglobin levels are sufficient, till they get treatment, the hemoglobin levels revert back to normal. Till then the patient is being tracked, and once the HB levels revert back to normal, then patient is being advised to take prophylactic dose. So this is basically the government is doing.
So many thanks, Dr. Sangeeta, for such a nice enumeration of all the policies which have been taken by government, and that has made our job very easy. As you rightly mentioned, that anemia, if treated well during pregnancy and in lactating mothers, will get the same iron get transmitted to the child. As a consequence, the child is born with less of deficiency. So our job is very well done. Second point, what you rightly covered is deworming. So yes, worms, parasitic infestation, they consume a lot of iron. As a consequence, kids tend to develop iron deficiency. So the government focus on these two at least recipients will help the kids in long way. As all of us are aware that kids are the future of the society, and you'll be startled to hear that after 6 months, if we don't supplement them with a good complementary diet and complementary feeding, and there is iron deficiency, then they tend to get loss in IQ of 10 points if there is 1 gram less of hemoglobin. So I'll start with my thing, which is like what is iron? So all of us are aware that iron is a metal. Although it does not look when we are consuming iron that it's metallic, but you can appreciate the taste. So there is abundance of iron in let's say green leafy vegetables, legumes, pulses, along with meat uh, and liver. The other very good sources and rich sources of iron which I usually recommend to all my vegetarian patients are jaggery, which is there in villages as well. So if we replace sugar with jaggery, most of the things will be sorted. And second and last is dates. So these two things, if consumed with lunch and dinner, would reduce the incidence of iron deficiency in the society. How does iron get absorbed? Once we consume iron, it gets absorbed in intestine. So intestines have to be healthy in nature. Uh, there are certain things which help in absorption, and there are certain nutrients which reduces the absorption. As you had rightly mentioned, so iron, what we generally recommend, if it's taken in, let's say, tablet or syrup form, should be consumed after food, so that absorption gets better. And especially with citric nutrients, something like strawberry or lemon or something of that sort, then definitely it helps in absorption of iron. And things like milk and other dairy products, if consumed with iron, will reduce the absorption. Therefore, these are to be discouraged while consuming iron. One more thing I would like to stress upon, as you had rightly mentioned, that once hemoglobin comes up, then we can think of giving prophylaxis. So, how does iron work? Initially, the iron gets depleted from the stores, and then later on, the hemoglobin reduces. On the contrary, when we are replenishing them, the hemoglobin gets better first, and then later on, we need to continue as long as the stores didn't get replenished, which means at least 3 to 6 months once hemoglobin gets restored. Uh, so I'll start my panel discussion with Kanika as to how can millets contribute to a healthy diet, especially for kids.
So yes, I think you really elaborated it well that how important is iron for our body. So what I feel is the most easily available and the cheapest source which we can get iron from is millets. Everybody is talking about millets these days. So millets, according to me, contribute to a very healthy diet for kids as they are nutrient dense as well as giving us a lot of health benefits. So they are vitamin and fiber rich. They provide us with lot of minerals like phosphorus, zinc, iron, and including millets in kids' diet will enhance their energy levels, support their growth, and give them a whole some nutrition that is required for their development. So I think the best millets for kids would be ragi because that's highest in iron. As Dr. Chhabra mentioned that yes, we need vitamin C to be taken with it so that the absorption is better. So we need to include all kind of citrus fruits, all things rich in vitamin C in the diet. And we have heme iron and non-heme iron. So heme iron is usually in the non-vegetarian food, whereas the non-heme iron is provided by the plant source of iron. So I think millets is the best thing that anybody can consume, and it's very easily available anywhere in India. So it will definitely help India, and there are a lot of fun ways also to have millets. People feel that millets are boring. How can we eat millets? How will a child eat millets? But there are a lot of ways today that we can incorporate millets in the child's diet also. For example, we have a lot of companies now available. Like we have Slurp Farm, which gives you millet pancakes, which gives you millet dosa. It can be cooked even at home easily. Like you mix up some millets and get a batter made. You can make dosas, pancakes. Then there are millet noodles available nowadays. So kids find it to be a fun part of eating. I mean, millets going inside and no consumption of any other flour or whole wheat flour or anything. So I'm sure millets are the future of India now, I feel. And they're gluten free, that's the best part. So any kind of allergy, if at all a child has, millets are the best thing that you can give the child as well. And yes, it needs to be incorporated with a lot of green veggies, fruits, and especially the citrus fruits. And the protein intake should be avoided when we are having anything rich in iron, because iron absorption hasn't happened. And a complete food for a child includes nuts. Then there should be fats included as well, like good fats, which I would call olive oil or avocado or coconut for that matter. Then we should have about 60% of school going kids usually get it from school as well in the lunch. So if you're preparing a lunch box, say I would suggest you give them for breakfast. You can give see maybe a poha. Okay, that again is good in iron. Then you can give them idli, you can give them dosas, chilla as well. I mean, I usually give my kids ragi made chillas made out of ragi flour, and my kids love it when I add a lot of veggies into it and just try and enhance the taste. I also give them dokla made out of sometimes I mix bajra and ragi, or sometimes it's ragi and suji, whatever. But I try and just incorporate these things in their daily diet and try and avoid as much as refined foods as I can avoid for the kids. Yeah. So, best time to consume millets, I prefer would be the breakfast, because it takes a longer time for digestion, since it's having a low glycemic index. So it stays in the stomach for a long time. So best time to consume millets is during the daytime, and try avoiding eating it in the dinner. So dinner should be the lightest amongst the entire meals of the day. And best part is that you give them in breakfast in the morning. We should not be giving meals to the children after 7:30 or 8, because the digestion becomes slower. And then if at all given millets in the night, it will take time to get digested and might give problems to the child, like flatulence or gas or something like that.
Thanks, Kanika, for the nice suggestions and uh, helping the parents in designing the recipe for the child. Actually, most of the parents get confused as to what to give, when to give. So, again, once again, I would like to say thanks to you for giving us so many examples as to how we can incorporate iron in their diet. Let me tell you the dosage of iron, which is 10 milligram to 11 milligram per day. Are there any ways to make a plate
That.
much more colorful? And besides being colorful, you can incorporate iron into that plate, like
So
putting
yes,
some
I feel
veggies,
yes we can do that. Like we
putting
know
some
that,
veggies into that to make it colorful,
right.
or
So like we know
strawberries.
that, right. So like I said, that a complete meal should include everything. So what I feel is even the nuts give you a lot of iron. Like you suggested that dates should be given to children. So nowadays we can make now we can have dates milkshake given to children, so people enjoy having that. Like you said, that protein given with something rich in iron doesn't help in the absorption. So nowadays I prefer that you give dates to either children when they are hungry. So this is like kind of a mid meal snack before the lunch or before dinner. And in the meal, if it should be including everything. It should be having a little bit of good fats. It should be having cereals. It should be having protein. It should be having all kind of green leafy veggies, fruits, everything. Now it should look colorful. And I think nowadays even kids enjoy eating uh, salads for that matter. I mean, my kids enjoy if I give them with a good dressing. So I sometimes put honey in the salads. I mix them with sometimes of sprout. There are sprout salad. Then I incorporate fox nuts, something like that, and try to make a very colorful salad, and they enjoy eating it. So when you give them a little bit of salad before the meal, they're half full. So then I'm sure it'll help them in eating more healthier and not go towards the junk. Okay, one question I would want to ask you, Dr. Chabra. How do I come to know that my child is iron deficient? What are the symptoms as a parent that I can see?
Very appropriate question. we have discussed a lot about iron, but the symptoms were missing. So the symptoms can be age range. So if a child is small, let's say in infancy age group, the child may not grow that well. So the most common thing what we see is that the child looks pale pink rather than pink. Uh, and that's because of increased milk intake and not starting complementary feed or supplementing at right time, which is supposed to be 6 months of age. So they tend to give a lot of stress on giving milk, which includes breast milk as well. Uh, that results in obviously iron deficiency where the child seems pale to us, not growing weight, being very irritable, refusing to eat foods, not means throwing tantrums at home. And later on, what we see is what we call as pica, which means they tend to eat all sort of nonsense things, which include they may be eating. You must have seen eating chalk or some paints from the walls, or
Right.
sand and soil and clay eating. So all this is known as pica, which means they are eating all sort of things. This is very classic manifestation of iron deficiency. And to your surprise, uh, these kids tend to suffer from a lot of infections because, as I had mentioned earlier in my discussion, that iron is responsible for formation of blood, and blood is being distributed to various body parts which carries oxygen. So once that is hampered, it's a developing stage of the brain and other body parts. So if oxygen is not reaching to them at a normal level, they tend to suffer a lot, which tends to persist later on during adulthood. So that's why acting on right time is much more important. So we need to supplement them if need be. But as Dr. Sangeeta had mentioned, that if a lactating mother is continuing to have this iron in her diet and through supplementation till the age of 6 months post delivery, that tends to help a lot.
So
So
it
these are
passes on
various
even to the
symptoms.
child. But
Yeah.
what if the child is in the age group of, say, 7 to 12? So, what would be the
Yes.
symptoms that I feel that I should get the child's hemoglobin tested?
Again, if a child is predisposed to various sort of infections, which include respiratory illnesses, which include various febrile illnesses, and once they are encountering a pediatrician at any stage, it becomes a pediatrician responsibility and duty to do a thorough checkup. And it's very easy to diagnose child when a child color seems to be pale pink, and they are to be seen inside this eyes, which a doctor tends to see. If it's not very pale, then it's a time to get tested and then start supplementing with the iron.
So, that should be like, along with the diet, a supplement needs to be provided to the child, right?
Absolutely. So you see, the point is when the child has arrived at a stage where is getting repeated infections because of iron deficiency, you cannot simply supplement with the diet. We definitely need to give medications so that the dietary, yes, it's much more of importance. So simultaneously, along with the medication, we need to emphasize upon the proper diet, which includes
So,
green
it's
leafy
like a hands in
vegetables.
glove situation.
Yes, yes,
Okay.
I want to add a few
Thank
things.
you.
Child will perform poorly also, inability to concentrate in school also. He won't play
ab-
well. He'll
absolutely,
feel lazy,
absolutely.
There'll
irritable.
be more tiredness, yeah, because there's
Sorry.
lack of
So,
energy.
so
Yeah.
the development of brain persists till 6 years of age. So at that time we need to actually supplement with iron and to make sure that the child is receiving diet properly.
Right.
My question to
I
Dr.
want to
Sangeeta,
ask.
I would want to know as to where India stands in terms of iron deficiency. Do you have any statistics?
Yes, India is like quite far behind. As I told you, India, according to NFHS National Family Health Survey, India has in children below 5 years of age, the prevalence is 69.2
Okay,
of anemia. In women of reproductive age group, it is 50.2%. In pregnant women, it is 42.2. In Delhi, we are doing better in terms of pregnancy and lactation. now little because of the ASHA workers and the increased awareness in people also, because lot of awareness activities, IEC and behavior change campaign, which is a constant and it should be sustained also. So changing the habits and the lifestyle modification of the people, that is also very necessary, and you have to inculcate those things in their life by actually constantly motivating and promoting the things, promoting iron rich diets and telling them, like T4 I said, test, treat, talk component is very important. So that's why the concept of T4 rooms. In all women are anemic between 15 to 49 years of age. That is the prevalence is 51.6. In adolescent, it is 51.6 again, and in boys it is 18.9. So the adolescent boys are fine.
I'm not
Basically,
surprised,
our
Dr.
aim is,
Sangeeta.
in girls, our aim is to maintain, according to WHO, the HB levels should be 12,
Right.
and in males it should be 13. Anything less than 12 or less than 13 in like in you or me, it we are, if we become iron deficient, we become anemic rather. And the around 60% cause of anemia is because of iron deficiency. And people
Oh,
are
I'm not.
aware of, people can take, okay, food, that is fine, but the type of food they are taking, the type of cooking they are doing, the vessels, the utensils they are using, and the sanitation, and the junk food, the excess use of junk food,
right.
that
Right.
inhibits, I think that inhibits absorption.
Right.
Uh,
Another
I'm not
question which
I
surprised
I
with
think,
the
had in my
startling figure
mind.
of with the
pardon.
startling figure. I'm not surprised with the startling figure of 70% to the tune of iron deficiency in kids, which is actually the scenario when I see in my day-to-day practice as well. So you can imagine when I was doing MD, the scenario was we used to see more of undernourished patient. Right now,
Yeah,
the malnourished what category what we see is more of
yeah,
obese. In the incidence of iron deficiency still
yeah,
remains same. So
yeah.
you are
Right.
surprised. Definitely, 70% of the population are getting food in a right proportion or much more than what I call as abundance of availability. But despite
Right.
that, because they are stressing more upon junk, that's why we are seeing such a high prevalence of iron deficiency in our society.
Yes, and
Yeah,
doctor,
I agree.
basically, one more thing is that compliance is also poor. Okay, one day they'll take a good diet, another day they'll again go on to this junk food, and
So
especially the
that's why it's
youngsters
very
today.
important to incorporate nutritious food through fun ways.
Yes, through
That's the
fun phase
only
and
way the children. So even schools are focusing on this now, and they try
government.
and make it a point that junk is served just once a week in the schools, if the meal is being served from school.
Yeah,
So that
even
is
the
really being
government is trying to include the private schools also in WIPS
right.
program and deworming programs, but it's difficult to approach the parents. So I think
Right.
in schools also, in the PTMs also, in the PTM meetings, the teachers should tell them, the private in private schools especially,
No,
the healthy
Dr. Sangeeta,
habits.
actually parents approach us to give consent for this deworming medication and iron. So we happily ask them to do so. So it's not that private schools are refraining from doing so. They are
Right.
actually participating in an equally good way.
Okay, but the WIPS program, everybody, it's not followed in private schools because their approach becomes a little difficult actually. So being a
Yeah,
pediatrician, Hannah, if you can like convince them, your regular clients, the school can
yeah,
start, the private schools can start the WIPS program and the deworming regularly. That is the thing.
yes,
Right, but I have seen that
Because private schools
even
say they
schools are
can,
emphasizing a lot on the intake of nutritious food. That's what I've been
yeah,
observing of late. Like I in my child's school recently, I saw that he's gotten a diet journal with him, and he needs to write what he's been eating the entire day. And then they have a discussion in school that what was good for their body and what was not good for their body. So I think when
it is
teachers
so good.
emphasize, it gets incorporated in the child's mind, and
yeah,
it's
yeah,
more easy for the parent to give the child the right direction and give the right food to the child.
yeah, yeah. You are right
So
that way.
kids listen to parents, less to parents and more to teachers
More
and
to the
doctors.
teachers.
Yes, yes,
So
Absolutely.
if these two
yes.
people
Absolutely.
tend to emphasize upon, then they tend to listen a lot.
Like even the parents are being told that please don't give them plastic water bottles, try and give them metal water bottles because plastic is not good. Kids have become so conscious today that I travel and I see that my child is not ready to drink water from a plastic bottle. He prefers that I mean I'll carry my own water bottle, mama, don't buy it from outside. So I've been seeing this of late that changes are happening, and I'm sure India will go towards a better future ahead.
Thanks, Kanika. I just want to ask you one more thing. The school, not every private school is letting us know the diet. They should,
Right,
in few private schools, they have a diet chart of
right,
young kids, and they ask us to
right,
make it. But
right,
it should be in the curriculum sort, and
right.
morning school health assembly at least once a week should be there.
I think it's been started in the most of the private schools here in at least in Delhi, Gurgaon. I don't know about the rest of India. So I feel that yeah, I think we should be doing it
Yes.
at a
Yes.
larger scale, and
Yes.
probably the dietitians should go and give prep talks to schools and tell them
Yeah.
the
Yeah.
importance
That's
of
what. Yeah.
having a nutritious meal through the day.
Yeah.
And I
Because
think that's
regular
how the
counseling.
teachers will also understand and will be passing it on to the kids.
Yeah. As a nutritionist, you can do a lot.
Yeah.
As a nutritionist, you can do a
I
lot.
want
Doctors
to.
can provide
That's
only
my
medicines,
that's
you
my
know.
motto right now. I really want to
Yeah.
help India become. I mean, I'm really working hard on my kids
Anemia
for that.
free.
Right.
Yeah. So you should start from basically work. You should more work on the little kids, and then
Right.
the little kids won't land up as anemic in adolescence, and then
Right. When
they,
they
in
reach
their
their adolescence.
pregnancies.
So I
Yeah.
think we all need to work as a team in collaboration with each other,
Yeah.
because what I feel is if a nutritionist tells the teacher can tell the children, and the children become more aware. And for sure, the parents want the pediatrician's consent in this. So we all need to work as a team to have an Anemia Mukt Bharat.
Yeah, and especially in pregnancy and lactation also, because while pregnant they can eat, but sometimes while lactating, they a few food
They
myths are there.
specify, yeah.
Yeah,
They
so
specify
they
that not to eat.
basically the people who are lactating, they don't take a
Right,
proper balanced meal, है ना?
right,
Sometimes they
right.
take only dalia, sometimes they take and they say कि the milk is not coming. They don't
Yeah,
take healthy
they
diet,
for
you know.
excessive milk production they do that. That's
Yeah,
what.
and so
Yeah.
they'll end up in and they'll end up being anemic again, you know.
Right, right. Absolutely, I agree. So I
So
think we've
compliance,
lost
awareness,
Dr.
counseling,
Chhabra here.
regular education, everything is required to combat anemia and to make anemia mukt Bharat and Delhi.
Right.
So let's work on it. And my
Yes, we
best
have to
wishes
work.
to
Same to
all of
you.
us.
Yes.